episode 2 of Highs in Healing, Nurse to Nurse Conversations on Cannabis and Psychedelics. I'm so excited for today. We are talking to Ariane, our new Director of Patient Care Services with Trusted Canna Nurse, and she's going to tell us about her psychedelic background today and who might benefit from microdosing psychedelics. So thank you so much, Ariane, for coming on. So let's hear a little bit about like your history with psychedelics. What makes you qualified to talk on this and to help people through their journey?
Yeah, thanks, Megan. I am super excited to be here. Psychedelics are definitely, obviously, a thing of great discussion and question these days. And my personal journey with psychedelics started several years ago. I just got really curious. I started doing some research. I honestly remember the first time I saw the word ayahuasca, and I was like, how do you even say that word? I'm so confused. And I was just really curious. I was really curious of how psychedelics might help me in learning more about myself and ways that it can be supportive in life. And it's just kind of evolved since there. As far as my own personal journey, it actually started before I really started doing training, more so when I was doing research in a master's program of nursing. And I just had a really profound experience, a psychedelic experience. And, from there on, I was able to safely wean off of my antidepressants, and I haven't been on them since, and it's been 3 years. So I was like sold at that point. And I was like, what can I do now? What can I learn? And I've done training in psychedelic facilitation of ketamine, MDMA, and psilocybin. I've also done some training in cannabis-assisted therapy as far as cannabis being used as a somatic psychedelic to help people kind of go deeper and have some release and stuff. So it's been incredibly fascinating, the things that I've learned. A lot of the things that I've learned around trauma and working with trauma, I wish I would have known when I was working bedside, in the emergency room all of those years ago. And I just feel like there's a lot of different advantages that can happen, with psychedelics. I mean, they've changed my life as well as other people's lives in big ways. So, yeah, that's where that's at.
All right. Oh, that's so cool. Yeah, I think that's at bedside, we never, and even in nursing school, we learned so little about trauma and how like the effects trauma can have on the body. But yet in our practice now, almost 100% of our patients have illness related to their trauma. So yeah.
Oh yeah.
It's fascinating. Okay. So you've done a whole bunch of training. You are a registered nurse with a lot of both cannabis and psychedelic experience on this. So why psilocybin? What is microdosing? Tell us about that and who could benefit.
Great question. My microdosing journey personally started a couple of years ago. And it's just been really interesting, the things that have changed for me. Like I said, I was on antidepressants and anti-anxiety meds, not consecutively, but collectively for like 15 plus years. And then coming off and like learning how to like really feel my emotions again after having this perpetual numbness that the antidepressants have created. Microdosing psilocybin specifically kind of came onto my radar. And it's really interesting, the things and the shifts that it made for me. It helped decrease the anxiety I had been experiencing. It enabled me to quiet the chatter in my brain that would kind of come on board when I was around other people, so I could kind of show up differently and connect to people in ways that felt like more like me and not this like, oh God, what are they thinking type thing. And it's been really, I mean, microdosing has changed my life in big ways, and the changes are really subtle. And it's kind of like just, it's like when you work out regularly and then you start seeing the results over time, that's kind of how it works with microdosing. People who can really find benefit from microdosing, and also like keeping in mind like the medications that people are on need to be taken into consideration. There's safety and efficacy that we can discuss like later on and kind of touch on or whatever. But people who can benefit from microdosing are people who do have depression, who have anxiety, whether that be major depression, treatment resistant depression, or PTSD. This is not saying this is a cure. This is not a cure, right? This is a tool that can be used to help us gain better perspective and also to help balance our neurotransmitters. That's one of the things about psilocybin is that the actual chemical itself looks a lot like serotonin. So it does not increase our serotonin, but what it does is it makes it look like there's actually more there, which can make people feel lighter. It can make, things feel a little bit more joyful and like sunshine instead of it being cloudy and gray all the time, right?
It's like like a supplement. Is that what you're saying?
Yeah, talking about just a microdosing of like a supplement, microdosing is a very small amount. It's nothing that you're going to be like feeling all over the place. It's not something that makes people hallucinate. Like that's one of the things that I get the most. Like, and to be fair, like there's people in my life who know what I do and probably think that I'm tripping all the time. And that's not the case. Like I'm not, I don't, it's if anything, I feel a little lighter on my feet. Like, thanks for that, right? But that's something else I wanted to say as far as who else could benefit would be people who experience pain. Yeah, because one of the things about pain, chronic pain and stuff like that is, building a different relationship with it so that you can have more ease in your life and less tension and less resistance. And psilocybin psychedelics, microdosing psychedelics really can be supportive and stuff like that. And I believe that there's probably an anti-inflammatory effect just because of the way the serotonin is, and like you feel better, therefore you're not hyper inflamed, right? It all works together like synergistically.
Yeah. And I'll add to that too, as somebody who does not have a history of trauma. I started my own microdosing journey like 2-3 months ago now. And it's been just like just so pivotal and profound, and like the changes that I see. Like I'm a more patient parent. Like I don't explode at my kids like I used to do. I find motivation to do things that would have taken a lot more, to complete, like cleaning out the garage, stuff like that. So it's been really like fascinating just in my very short and brief, tiny little journey, that now I feel like they're like, when I'm in a mood, I'm like, okay, maybe I need like a little bit of an extra lift. And again, it's just one tool. Like, of course there are like, you still have to be exercising and meditating and eating right and doing all of those things. It's just one tool, but it can be really beneficial. Who might not benefit from psilocybin microdosing?
So, great question. And to start that, I'm going to go back to the fact that this is just a tool, right? I started my healing, my expansive journey, whatever you want to label it, with yoga, with movement of my body, with changing my diet. And foundations are things that help microdosing work as a better tool and help psychedelics work as a better tool. So people who may not benefit from doing things like this are people who are looking for a quick fix, people who don't have like other tools that they utilize, right? Because this is just one tool and it's not near as effective as if you're eating a healthier diet, right? If you're not filled up on like carbs and all these things, like it works better if you're moving your body, right? It works better if you're journaling. And I mean, that if first of all, like, it's important for people to be moving into a direction and to want to incorporate this as a tool, right? People who have history of psychosis, right, or schizophrenia, they have unstable bipolar. Right now, there's not enough research that supports the safety and efficacy of this with people who do have those things. When I did my training last year, there's something to be said specifically around bipolar and psilocybin, and it was noted that people who have bipolar could possibly benefit the most from psilocybin. But the way that research is evolving, and because you have to evaluate risk versus benefit, and sometimes the instability that can occur with bipolar depression, it's one of those things that it's just taking a little bit more time, right? So that's not to say that it wouldn't be a possibility in the future. It's just right now, like with the limited evidence of safety versus efficacy, and even from an anecdotal standpoint, right? There's things that we have to look at and take into consideration. There's different medication interactions that can occur, right? Safety versus efficacy. It comes into it again, like certain medicines that interact really poorly, some of them that completely make it where it doesn't work at all. And that's where it is really beneficial to work with somebody who knows what they're talking about, what medications can be utilized, which ones can't, is this appropriate? And, again, it's not to say it's never appropriate. It's just like in this moment. So if someone was to come to me and they're like, I want this, this has to fix everything, blah, 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 blah. They're all over the place. Like, and they're just in this state of, I don't want to say it has to be organization or like this state of like they need more grounding, right? Then I'm going to help them figure out foundations before we actually start the microdosing, if that makes sense.
Yes.
Because the microdosing is going to build off of and enhance those foundations. It's not the other way around, right? It is and it isn't. They go together.
Yeah.
That's who would be appropriate, right?
Okay. Yeah, that totally makes sense. And I think that just reiterates like the importance of having like not doing it by yourself, and like having full guidance. So thank you so much for that. So this is the end of part 2 or episode 2. Next time we can touch on more psychedelics. Let us know in the comments what questions you have on psychedelics, and we'll see you next time on Highs and Healing Nurse to Nurse Conversations on Cannabis and Psychedelics.